Thanks, everyone. My name is Nancy Stewart. I'm a health promoter with Public Health, Healthy Community in the Nova Scotia Health Authority, based out of beautiful, sunny Wolfville, Nova Scotia this afternoon. I want to start by acknowledging that I am in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. In my work with Public Health in this province in Nova Scotia, we've developed a purpose statement. So you see that on your slide. Public Health works with others to understand the health of our communities and then acts together to improve this health. So the communities are those in which we live, learn, work, and play, greatly affect our individual and our population health. So our work focuses on creating supportive environments, both social and physical environments, healthy public policy, and then the community action to promote health, which is our community engagement piece. And a big part of that work is in reducing health disparities and addressing inequities, particularly systemic inequities. Within our work in public health in Nova Scotia, we've developed some protocols which guide our work, one of which is the Healthy Communities Protocol. So under this, this is our work that conducts assessments. We seek to understand the population health level impacts and the population health status, particularly of priority populations. Improving health, so we have our health equity protocol. I'm going to speak a little louder if folks can hear me, but please let me know. So improving health refers to the broad determinants of health and health disparities, that systemic context, so using the concept of social justice and how health inequities affect our population. So that sort of puts in context my role in public health here in this province and what guides my work. So from all this, one of the priority areas that emerged with the last couple of years has been a lot of work bubbling up around housing. So a key focus area for us in this work has come together with the work of a lot of our partners. So similar to Heather's work here in this province, we work with our community health boards. They have recently developed a collaborative health plan, of which housing is one of the priority areas. And from this work, we delved into engaging the community to look at a supportive housing needs assessment. So that was in 2008. This involved data collection, analysis, and interpretation, real collaboration with a lot of partners to pull this off. There was a real readiness of partners to look at this focus area of housing and identifying some gaps and vulnerabilities, really bringing that equity lens to that. So we saw the community interest, that groundswell, and the partners coming to the table. So we delved into this quite an extensive supportive housing needs assessment. You'll see the DASH group website on your slide, and all our reports and our information are located there. From our housing needs assessment, we really developed, I think, quite a comprehensive community engagement plan. We engaged multiple stakeholder groups, including First Voice, so folks who have that lived experience. So our assessment was primarily an online survey format, but we also took into account many people, for lots of reasons, don't have access to online, so we did have paper copies of our survey. We also did targeted community engagement sessions with some specific target focus groups. So those would include folks living with mental health challenges, as well as some of our homeless and precariously housed youth. We also looked at a community engagement from our service providers, so again, the online survey, and also stakeholder groups with those as well. So these were folks who actually work with those who have some housing concerns. So our community support workers with mental health and addictions, social workers with the Department of Community Services, and those types of service providers giving us their feedback, and then stakeholders, so landlords, developers, and builders. So quite a comprehensive community engagement plan was rolled out over a number of months. From that, we've, as I say, generated several reports, one of which is this precarious housing and homelessness across our rural communities. So one of the things I'd like to highlight is our context. We really bring that rural lens to our work. There are many disparities and inequities that exist in rural Nova Scotia, rural Canada, I'm sure, that sometimes are overlooked when we look at universal policy. So we really paid attention to that. So this included our targeted community engagement, particularly with youth. And we heard it in Heather's presentation. We were really conscious of that, sort of that IAP2 promise. You know, what is our promise to the public when we're engaging them? So one of our key partners were our municipal units. They partnered really well with us to help fund our needs assessment, and to also, our promise to them was to then be able to provide a report back to them, giving some more local level data that municipalities could then use with their planning departments, with their municipal planning strategies, and those sorts of things. In our assessment, someone said we were a product of our own success. So we had tremendous uptake. We had almost 4,700 people responded to our housing survey. This was around the western part of Nova Scotia, so the western area of our province. For most of our areas, we had the uptake enough to make this statistically significant. And as I say, with our municipalities and our local government as being key partners. One of the things that was really astounding to us is that 37% of all of our respondents reported experiencing housing insecurity. So that was a real shock, frankly, to a lot of us, even those who are working in this. So we knew that we were on to something important, creating a lens to look at these inequities through. From our data, we also realized that 36% of folks who are housing insecure have full-time employment, and 61% have an income of less than $40,000 a year. So it brings all those conversations into poverty lines, low wage, precarious employment, and that threshold. So from this, truly youth emerged as one of our key audiences when we look at equity and the impacts on health, and how might we engage our more precariously housed youth. We heard some quite startling comments in some of our targeted engagement. So I share this quote: when you lose your place to live at a young age, you fall behind. You go into the real world when you aren't ready. You can't go to school or university. You have to find a job and be an adult when you're supposed to be a kid. So that was sort of really eye-opening to us in terms of some of the true feedback that we heard. This slide, it's not a sleepover if you can't go home, speaks again to that rural context. Often homelessness looks different in our rural areas. It is more hidden, it is less obvious, and therefore sometimes harder to really work on and to bring that advocacy role to that. Often folks are couch surfing, and we heard from one student who was trying to finish school, stay in school, but then would be called out by the teacher because he was on his cell phone during class. What the teacher didn't realize is he was actually madly texting around trying to figure out where he's going to sleep that night. So this connects to a lot of our work. It would definitely connect to the status of mental health with a lot of these young folks, food security as well, and certainly connects to the work that we do here in our healthy school environments, working with education and health to provide those supportive environments. A couple of more quotes that we heard, you know, that sort of, it's not the youth's fault often that they're out there, they're not terrible people. Sometimes they've gotten away from horrific situations. And this last quote, the best place I've lived is in my car, it's quiet and I have my own space. That was from a young man that I actually facilitated this focus group, and it was so humbling to hear that. So these quotes point out, you know, some of the challenges, the stigma, the judgment, the fact that there is a lot of equity that is lacking, speaks to the safety of a lot of our young people, personal safety. Certainly we heard aspects of sexual health promotion that would come into play, food security, as I said, and that real sense of belonging. We know that our sense of belonging is so important to our health, and for these folks, this priority population, that's not often the case. So from that, we looked at what was happening locally, and it was actually really good timing because there was a group locally working with youth out of the youth portal that were coming along with this strategic plan, this Homeless No More for Youth plan to end homelessness, youth homelessness by 2027. So a 10-year plan that started in 2017. And so we were able to partner with them and really kind of dip our feet into this community engagement. By doing this, Public Health was invited to the table to be part of their lead team, this intentional backbone team. And the collaborative partners were really intentionally invited across all of our systems to begin to hopefully break down a lot of these silos and to work in a way that was going to be able to bring more equity to the table. So the partners in this lead team include our community health boards, education, justice, health, recreation, policing, community services, and so on. So folks were asked to come as part of this lead team who were also able to really be decision makers and had some of the power to change some of the systemic policies and procedures that often were creating the inequities. Through this, we embarked on a really cool project of collective impact, and we began on our theory of change process. So it was embedded in learning, research, and evaluation. We partnered with our Inspiring Communities partners here in Nova Scotia, who are doing terrific collaborative work. And we began to organize our process in a way with this theory of change that we sort of started at the end. So we started at where we wanted to end up. So Annapolis Valley youth thriving in safe, nurturing, loving homes, really hopeful for the future. The biggest part of this is that we had several days of facilitated conversation and workshops to develop this process. And youth, as our priority population in this case, were brought in from the get-go. They were really engaged as part of the process. Very authentically, I heard Heather speak about that in her presentation. Really intentionally and authentically, some genuine conversations were happening. By inviting them in, we really had to be clear on what we were promising them and to be really open to listen to what the youth were saying, and began mapping this larger visual with a supportive narrative to support that. And the youth were really engaged. They could tell it was authentic. They could see themselves in this process. They were listened to, they were valued, and we really had to pay attention to what they were saying and incorporate that. And we saw that the youth were developing pride in telling their story and in this process. At the beginning, where we started, we sort of looked at the current situation of youth homelessness. And the youth were very engaged and quick to tell us that it needed to look dark and lonely. There needed to be sharks in the water, that isolation of them sitting on an island by themselves. And we needed to get at the root causes of why youth homelessness exists. So looking at those systemic changes, that it's not the individual's fault, but really those systemic barriers and changes. And the community being open to hear the realities. So we changed that based on what the youth were telling us. But then there was this real underlying also theme of hope and freedom, that will for change, which was important. So the systemic changes, looking at shared policies, improved practices, collaboration, the solutions from systemic barriers to creating more improved equity were really important. And the youth got that. They are living that. And they were able to tell us that it wasn't just one individual problem, but they could see the systemic changes that would need to happen to create more equity. Working together, that shared responsibility was really a key theme as well. We invited in what I sometimes refer to as our unusual suspects. So folks who often aren't at the same tables that we sit at bring a different perspective. So a great example of that, at our lead team table, we would literally have a homeless youth sitting right beside the local chief of police at the same table, creating dialogue, sharing experiences, and working on the solutions together. And the supports, you'll see a wide variety of supports here. This is truly that collective impact, so systemic barriers to work toward creating more equity. So it's not just us in health alone, but really that collaborative approach to the support. One of the things that we heard with this true community engagement was something that we missed. We didn't go there at first, and it was really an aha from the youth. They talked a lot about experiential learning, so they wanted to tell us how important it was to see that, that we could show them people who had made it, people who had changed their trajectory, and truly at the bottom of it, they were really just looking for love, which, in a community engagement world, really kind of simplified things for us. So that was quite beautiful. They talked a lot about strengths-based. They liked it when folks referred to them as survivors of system inequities and not just victims. They had a real theme of give a fish, feed for a day, teach the fish, feed for a lifetime. That sort of mantra, so that was really empowering. And we looked at other things going on locally in terms of what's happening to engage youth. So locally there is a Kings County Municipal Youth Council, which is the council of our local municipal government made up entirely of youth, which inform our government on all issues with that youth perspective, so true youth engagement there. And as well, through our program, we were able to launch the EDGE program, which is a skills-based sort of peer support program, helping youth become reemployed, which again is going to really change systems because we had employment, education, justice working together to do that as well. So in wrapping up, just to highlight that really it was that trust, that authentic trust, those connections, the partnership within our community engagement was really the key. The final slide is the finished product of our change theory map, so very busy and colorful, but truly something that the youth themselves really take pride in. They can see themselves in that. They can see that their input was heard and incorporated, and this is now the basis of a lot of the work that we're doing. So I thank you very much for listening to that presentation.
Thank you, Nancy. I love listening to you describe the efforts of the project, the Ending Youth Homelessness Project. And in our conversations, there have also been a couple of things that you've mentioned to me that have really stuck. And one story you told, and I'm not sure if you said this specifically today or not, but you talked about when youth are at the advisory board table and when you have homeless youth that are sitting right next to the chief of police, sorry, I should talk louder, right next to the chief of police, that there's power in that, and that's a powerful image for me to think of when you can connect community members with people in formal positions of authority, especially law enforcement in some cases. And then I think about another thing, and I can't remember if it was you or someone else that said that to me in the past few weeks, talking when you mentioned collective impact approach. It's that question, and as we move into some interactive pieces now, it's the question of how do we make sure that at a collective impact table, the priorities that come forward are really the priorities of the community members and not just of the people that happen to be sitting at the collective impact table. And, you know, not just the people that happen to have a space and place physically, that they really do represent the community. So think about that as we move into a little bit of polling.